So, okay, good morning, everybody. Good afternoon and good evening for people in Tanzania and everywhere. Today is October 19th, 2024. It's 9:09. Thank you very much for everybody coming here. So we came back safely, and we thank God for all the blessings while we are there. And we definitely thank you, Mr. Steve Jones, for all the prayers. And every day, everywhere we go, so God was with us, and we're always grateful for that. And I'm thankful for all your family members who supported you, allowed you guys to come, and then they were with us through the journey and enjoy the pictures, because I get so many comments that people were like, oh my goodness, I felt I was there. I'm like, yeah, but you didn't do the work. No, I'm just kidding. So, but it was very nice to get the comments from people who did not go. And then a lot of people are inspired because of seeing everybody's involvement, doing something in there. So there's especially people from America, they're saying, you know, when I woke up in the morning, I see all these messages. I'm like, almost I'm going to be late at work because I'm trying to see, what are they doing? What are they doing today? So it was very good to see the family getting involved. And I appreciate that you did share with your family to connect with me if there's any concern. And then a few of you family members did communicate with me where there's network issues, and I was able to relay that information. So everybody got the information as soon as they can. Everybody agreed that it was very good to see you guys posting, different people posting, so they can see different angle of the mission instead of just only one person. So that was very good. And again, thank you. And thank you again for every person who came and do the medical mission. And I definitely thank you, my husband, for all your support and guidance and helping us, definitely, especially for the group of the school. And then definitely, so it released my stress from worried about if the school is being taken care of. And again, thank you everybody for being here. So if there's nobody has any question, I think I can just bring the agenda quickly and start do the real presentation and give you the summary of what happens. Anybody has any something you want to say hi quick, and you learn some Swahili, you want to say hi? Yes, go ahead. Oh, you're muted. Mi esposo, you're muted.
Am I on now?
See.
Sorry about that. No, I was going to say, I wanted to greet everybody individually as they were coming in. I saw Brianna, not Bree, but Brianna, Charlotte. I see everybody. I'm like, I want to greet everybody individually, Audrey, but I'm just going to say hello to everybody. And it's good to see everybody back. Even some of the folks from prior missions, I guess, members and friends and stuff like that. So good to see everybody. Big hug. Habari gani? And that's it from me. I'm complete, as they say.
Good morning.
Good morning. Anybody wants to say hi? Sorry.
Good morning, everyone.
Hi, Miss Charlotte.
How's everyone doing?
We're doing great. We're blessed.
That's good.
Anybody?
Good morning. I hope everyone have a great and wonderful day. This is an awesome meeting. We had a wonderful trip. Thank God everybody came back safe, and we did do a lot of things this year.
No, definitely.
Amen.
Definitely, yes. So that was a huge blessing, definitely. Anybody else?
Good morning, it's Audrey. I don't know how to come off camera on this phone, but it was a wonderful trip. I was so happy to be a part of it, and glad to hear, upcoming events and fundraising and things of that nature.
Thank you very much, Audrey. You were a huge help definitely in the hospital. Thank you.
I learned so much.
I did keep feeding on to your excitement and stuff, and I was like, just pushing me, like, I need to keep going. She's like,
Yeah.
I learned this. I'm like, oh, that's what we want to do. Thank you. I love the positivity. The positivity drives everybody, fueling everybody else, because remember, we are not getting paid back, like a monetary.
That's right.
But I mean, my heart is filled. So I was so happy
Mine too. Mine too.
to see
Yeah.
individual volunteers are getting so excited. I'm like just pumped up. I'm like, yes, we can go. We can do this. Yes.
Yes. Yes.
So thank
And then the children at the end, and the children and the ceremony that they gave us. Oh my God, that just ended it all. I still feel so happy, and honored that they were so loving, and the food and the fellowship. It was just beautiful. It ended so beautifully. The children, I don't know, it just was wonderful. Yeah. But I'm complete too.
I know. Okay, yes. Anybody else?
Can I say something
Yes,
though?
please. Yes, please.
I was really, really inspired by this mission. And I have been talking about it since I've been back. There is so much that I want to do to add to the mission as far as donations. And I've been speaking to some people in regards to finding out how we can have a drive or submit letters at least to a lot of the sneaker manufacturers, because that's one part of the mission that really got to me. Seeing the kids with the without shoes, some just walking barefoot, some that was walking with socks, some that had shoes were about to come out, burst out of the shoe, and walking around in the area that's not level ground. I even had challenges walking around. So I want to try to focus in that area. And I said I would speak to you and Dr. B about a way that I can get correspondence from the mission to submit, or with your help, submit something to the sneaker manufacturers so they can at least donate. I don't know if you have already. I should have asked that first.
No, not yet. Not yet.
Oh, okay, good. So I would like to be a part of getting donations for the kids, because the sneaker manufacturers, I know they have a lot of irregulars, and I don't know what they do with them, but what really excited me is the kids in Tanzania in that school. They don't think about name brands like the US kids. And I have to put it out there. Our kids here in America is so into name brand that it's ridiculous. And I am a mother of two, and I help play the part. But I always made sure it was on sale. I'm a sale person. I didn't purchase if it wasn't on sale. So with that said, I would like to be a part of that and getting those sneaker manufacturers or shoe manufacturers for children's shoes, various sizes, their irregulars, and see if they could donate it, because it'll be a tax write-off for them. So I just want to put that out there, and you and Dr. B talk it over, but I would like to be a part of that drive to try to get that spearheaded.
Miss Charlotte, thank you for blessing us with that idea, because we have been talking with my husband here, the same thing. We are trying, in the next time, we are trying to get people to do things, focus on each project versus focus on everything. So that will definitely help us. If you can be in that group, and definitely we want you to be in that group, so then we can focus, and somebody's focusing on the shoes of the kids. That is a great idea. But I know, I understand, and I saw that part, but I mean, remember growing up, I see that luckily that myself have never experienced walking without the shoes, but I have experienced that my mom and dad buy me new shoes. And when I go to play, because I don't want to mess them out, child's mind, I would take them off and play barefoot when I finish, and I put them on and come home because I want it to last longer. So, I mean, it's a lot. I mean, because as I said, the children are not thinking twice. They will walk on those unpaved roads. They will play soccer without the shoes. And then if they have brand new shoes, they're going to save it. They don't want to mess it up because they want to keep it in church and all the stuff. So it's a lot of things going through it. they don't see their limits. They just say, okay, if I don't have the shoes, I'm going to put it aside and play without the shoes. That's how their openness there. So if we can help them even for a little bit, and thank you very much for observing that and just pick on it and try to say, I'm going to take charge on that part. And we will be very happy to share with the material content and the templates from the organization. And so it becomes part of it. And we'll be very happy to have you on that team, definitely.
Thank you. Thank you.
Yeah,
I was very inspired.
Yeah, we'll give you a call, Charlotte. But I was gonna say too, I think for the trip, I think you exceeded your expectations. We weren't sure, you know, what to expect when we spoke to you. You know, we hadn't met you yet or anything. So, but then we got there and realized, oh no, she's good to go. She's got this under control. So you exceeded your expectations, and you definitely were a blessing, and you helped out a lot, and it was good to have you there. So we appreciate you, and also the intellectual part and the spiritual part that you bring, and some tenacity too. You got a little bit of that, as they say, that chutzpah.
I guess that's from working at the courts.
No,
Well, I had a lot of it before that, but anyway.
No, but it's a very good thing to see. And that's what we want for future mission, that people who are purposefully, like you are going there for a mission. You're not going there for catwalk. You're not going there just for people to wait on you. You are going there to help those people who don't have the resource that we have, and then just try to help them one person at a time. We always say, either in the hospital, take care, train a nurse and a doctor to go and take care at least one person and save a life, just one. Do the CPR for the nurse or doctor who is going to go and do a CPR and save at least one person. So if everybody is doing that, we're going to be able to save lots of lives. The same thing for the children. If we help one child and then they get inspired so they can break the cycle of poverty, that's what we want. That's it. Okay.
It made me good that I made a difference in some of those children's lives.
Exactly.
And they don't know, we did something for them. We went there with doing something for them, but they don't know what they did for us.
Yes.
And that feeling is carried over till now. And I believe it's going to last a lifetime.
Yes, definitely. Thank you very much for sharing. Yes. Okay. So let me start by sharing my...
and then while you're sharing, I'll just read here. Denise posted, yes, I felt like I was on the trip too and not doing the work, but I enjoyed the journey. Sorry I couldn't go and take part. And then she said, I guess Charlotte's idea is a great idea as well.
Yes, no, it was a huge blessing. It was a huge blessing. Okay, I'm trying to open this. And so now, sorry, October 19th, it's a summary of what we did in Tanzania. Okay, so I did send the agenda so people know that, but as I said, you can see a lot of feedback. We really need to listen and build it from there so we can make it more efficient, and we can continue paying forward for these projects. We share that link towards the end. So for people who are listening for the first time, maybe they didn't know that we had a medical mission. So usually in order for you to go to a medical mission, there's a requirement that you have to go through. So usually we always have some documents that you have to sign in, things that you have to keep HIPAA, that you're not sharing the information, personal information, or use it for your own, I don't know, like advertisement or something like that. We try to, if there's something that we are doing there, like the same thing like we were talking about the shoes. So if we take those pictures, taking those videos, we can use purposefully for that part, a project, to raise money for the specific picture that we're using for that event. So the idea is, like, for example, I can't take a patient's picture maybe for the thermoregulation and then go and say, you know what, this is usually I have to take care of the patient, and then sell it to somewhere else without using it for raising money to buy the blankets and stuff to go and provide for the next person at the hospital. So it has to be purposeful. If we're taking those pictures, that's why we're saying you have to be aware of what you are doing. We don't want to disclose the individual information. You can take a picture with a patient. It can be your own, but you cannot use it for advertisement as if and something that is not related to what the mission was. Shipping, definitely for any mission, we always try to collect the supplies and we do the shipping. So we want us to know when do we collect, when do we ship it, so we can have it when we're doing the volunteering. So we are thankful that we were able this time to collect the stuff ahead of time, and some of the stuff we took with us and then we were able to use during the medical mission because everything arrived on time. Definitely, we have to include the flights and travel insurance. Insurance is for our protections and flights, of course, so we can get there. So we have to do all those arrangements beforehand of time. Of course, I always just say, before thinking of any medical mission, think of the passport. You need passport to get out of the country. So the passport is even before you think of coming. And of course, it should be not expiring within 6 months because sometimes we get the visa almost 2-3 months ahead. And then, of course, if you are going to the country, by the time it's like 2 months left, they might not let you get in the country or get out of the country. So that's going to create more issues. So we always say, I mean, when you're planning to go, make sure your passport has more than 6 months of expiration. There's some amount of money needs to be collected for logistic in Tanzania. We are working and we're purposefully for the future medical mission to try and get those expenses reduced by working with hospitals, working with schools, working with the government to try and get some of the discounts or even some that those areas can help us pay for some of the expenses so we can reduce the amount and then at least reduce the burden for the volunteers. So those are things, works in progress. And then of course, yeah, like this time we apply visa during July. So that's 2 months before going there. And then we are staying there 2 weeks. And then, so if you're also people staying a little bit longer, maybe almost 3 months. And then, so usually your passport has to be, have more space for them to, for the immigration people to allow you to move around. With every medical mission, definitely we need immunization and medication. Immunization, those are basic. If you're healthcare workers, more likely you have all the shots already, except hepatitis A. So hepatitis A is almost like protect you from the food-related things. You're going to eat something different. You're going to drink water that you're not used to. We did try to get water bottles everywhere we go as much as we can. And so people had access to those water everywhere we go, and everywhere meals we bought, we are getting the water included in there. Medication, definitely anti-malaria, you have to get it, even if even for someone like me who have been in the country too many times, even sometimes twice a year, I still have to take the malaria medication because of the mosquitoes. So we don't want to get sick. As far as I know, up to now, nobody had malaria so far. So we are praying and we're grateful that all the medication hopefully worked for us. And then people didn't have any problem with that. And then, so of course, a lot of projected projects were there, and then we were able to do and more stuff. So I have summary of each project so we can see what, just roughly summary. And then of course, we're gonna have a bigger write up with all these projects, how many hours and stuff laid out towards the end of the year, because we have to write summary of all the activities in the whole organization. And then, of course, the schedule. We can't do anything else without a schedule. The schedule is not perfect, but at least it's something that it can guide us to know where we are going. So we usually review here. Some changes happens if, like, when we got there, we find out that the school was the holiday on Monday. So we got everybody else to go to the hospital. So we can change as we need to, but most of the time we have some guidance. So if you're going to school, you know you're going to school. If you're going to the hospital, you know you're going to the hospital. So something was arranged that way. So we were grateful to have all those stuff. Okay, so the volunteer came to different 6 areas. So they were from New York team, Ohio team, DC team, Team Dallas, Team Tanzania, and Team Miami. So definitely you can see it's almost throughout the country and Tanzania, people are invited. So we invite anybody from anywhere. So if you are willing to come and join us and work with us, definitely. It's not only just you're going to work out on the medical mission. We want to work with you even before we go there. So a few months before that. So like I said, the purposeful future mission, we want to be able to have teams already formed maybe 6 months before that. So we have idea of, okay, this team is going to be doing that. So maybe for the teams that we can do contact with people from Tanzania, we want to do that maybe in March and April. So we start communicating. So by the time you go in the medical mission, you know those people you're going to work with. It's almost like become your colleagues. You have your contact information with them. So we don't get there and people are like, okay, who am I working with today? No, we want you to be able to have that connection with that person. When we arrive, they're there, they come and meet us, and then everybody knows what they're doing. So it's something that we're trying to streamline to reduce the need of like, okay, every morning, okay, let's try to find out who are you working with today. No, we're trying to reduce that because for example, at the hospital, we want to make sure when you get there, you get to the hospital, you get to the unit, you start working, whatever, because every time is precious. We don't have that much time to roam around. So that's the area that we did notice that this time we want to clean up, and the next time it should be a clean, straight movement there. Of course, with the expectation of those logistics, usually you're expected to pay $250 non-refundable. So this is, as soon as you sign up, we have to start registering and start finding the invitation letter. So those are the communication and things that needs to be done transaction-wise ahead of the trip. And then that's why we say like it's 250, because sometimes we have to, like for the safari, I have to pay a deposit even before the final confirmation of people going, because I have to clear space, because the group can be large. So right now we were 14. So definitely to get a 14 area space, you have to give the reservation ahead of time. So that's why sometimes I'm already paid, and some people say change their mind in between and said, oh, I can't go. I understand, for example, if you cannot go because you are sick or some emergency happened, I know things happen. I don't have any problem with that part. But it's just because as soon as you said you are going, I have to increase your number and tell them over there that, okay, this is how many people are coming. So we start blocking stuff. Everywhere else, they say, okay, you have to give us a deposit. And sometimes it's non-refundable, because once you change it, everybody has doing the business over there. So they're going to say, well, I block the hotel for you. I block this area for you. I block the flights for you. So I block the bus for you. So you have to agree. Everybody have to do their business. But anyway, so this time Tanzania logistic was $1,590 for a single person. So if you're a couple, because some of the rooms you have to share, so then the amount is going to be a little bit less. But at least nobody paid more than $1,590. Individual expenses, that one is like people doing shopping. I can't limit you from whatever you want to do. And I know people thought they're going to shop a little bit, but they end up doing quite a bit, which is fine. Everybody's allowed to shop and do whatever they need to do. So whatever you pay the $1,590, the $200 and $250 included in $1,590. So you're not paying more than that. And then of course, accommodation, meals, transportation, all of it is included for $1,590. So we did stay in the Maj Hotel. And then, of course, the work day used to be like we can wake up at 6 in the morning or between 5. Majority of the time, we try to come in a little bit before 5, but it depends on transportation, whatever it is. And then, of course, as a group, we stay in one place, we travel in groups. And so a lot of stuff we're doing in a group, unless if somebody gets sick or somebody has to go back by themselves or something like that. Those extraneous activities, yes, but we try to limit those ones, because anytime we ask for an extra transportation, then we have to pay more. Thank God we didn't have excessive of those, so we didn't have to pay extras stuff, but it was within our negotiating prices. And of course, Tanzania speak a lot of them is languages, Swahili, but also the instruction language is English. So for some people, you've noticed that they do speak English even in the hospital, and some of them in the school a little bit. Some of the teachers were able to communicate with you guys. They might not be like fluent, but at least they will understand what you do. And of course, for the local individuals, majority of them speak Swahili. So this is how we arrive. So you can see everybody has their a lot of suitcases of the surprise and stuff. So we were like almost going out of space. But anyway, so thank you everybody for being there and coming on that day. And then, so of course, for collection of all the shipment. So the first shipment was sent on May 6th. And then the second shipment was sent on May 25th. And then, so all these things were collected, and we found it there. And then, of course, we added more stuff with us when we got there. So this is one of the, when we arrived, after we rested a little bit. So
and look how he turned out. I know you're sorry. It's okay. I made a person better, right? I'm sorry. Even so. And you left.
Okay, so you can see people having too much fun. Still, the jet lag is not hit us a little bit, because that time was in the afternoon, so which is in America, it was in the morning. So thank God everybody did okay. And then, of course, we added more stuff. So we were doing things in phases. We started with the bottles. So we were labeling and put all the QHSC labels, because these are the ones that was going to be given to the children. And then, of course, you can see on the bottom left there, those are the sanitary pads on the bag. So we didn't have to do anything on that day because we had so much stuff and we had to save it to us, because we were giving the sanitary pad the second week. But the water bottles were given the next day when we were going to school. So we were doing things in phases. Okay, so the same thing on the left side. These are the things that the donations and people were buying stuff to add it to the school bag for the kids. So the volunteers were sorting them out. And then so you can see all those things. Even the last day of school, all the kids were getting. Kids were so happy. The kids were so happy to get those bags. Okay. And then so for projects, so these are the ones that project that we wanted to go and do over there for the community programs, which include the school, was the nutrition, hydration, sports, magnet, vision screening, hand washing, and dental hygiene and sanitary pads. And then, of course, at the hospital, we had the Help Baby Breathe, the thermoregulation, prevention of postpartum hemorrhage, ICU, and anesthesia in one area, and then compression. So that's what we plan to go there and do. And then, of course, the school collaboration. This time we were not able to complete what we wanted, but we're going to reconvene and plan for next time so we can do a little bit better job with that area. So with every morning, of course, we start our day with our prayer warrior.
Let us be accepted by them and bring forth, God, the things that we need to give them, God. And also let us learn as well. Let it be a productive day of God. A day on both sides of the house. And we take both the learning of God and combine it together with our experience of God and make it awesome for all the people. Lord, we ask you right now to bless this food right now, God. Do it for your glory. In Jesus' name we pray. Amen.
Oh, we forgot to say, what was the last sentence we always say?
Good God.
And?
Good meat.
Good food, good meat. Thank God, let's eat.
Exactly. So okay. And then so that's the food now. Everybody was digging in. So that was the first day we were trying to go to Mwananyamala. So we had to eat. So this is the evening before we go, yeah.
No, there's watermelon there. There might be passion fruit there too, but I think there's watermelon.
So we do eat as the group. We do eat as a group. Okay, then once we eat, we are nourished, then we are blessed, then we start waking now. So for the community program, for example, the nutrition, we had to do those water bottles, as I said, every child had, so we had 950 water bottles for the students, and then the rest we give to the teachers, and some of them we give to the magnets, the athletes. So this is, as I said, people are working. It takes everybody being there. So as a volunteer, when you get there, yes, we give you time in between to rest, but after resting, we need to work because we have to get ready for the next day. Okay, so for the nutrition, of course, we continue. They were cooking. Those are the area that, you see them cooking their food. And then, of course, that's where the area they do their vegetables. You can see the cabbage they're cooking for the students, so to try and prepare their food. It's a lot of stuff. They did ask previously about the kitchen area, cooking and stuff like that. Yeah, so when we receive those blessings from God, then we'll be able to help them and try to get that area that they're cooking a little bit cleaner and stuff. You can see it's full of soot and stuff like that. There's a lot of stuff we can do, but we're not be able to do right now because of the limited funds, but we are working on it. And we want people to be inspired to help us to be able to reach that goal. Just we want to make sure that they're cooking at a safe and healthy place. But at the moment, that's how they're doing it right now. And we're praying that the children have been eating the food from there and nobody has been sick. So thank God for that. But still, we know the standard that they should be, it should be raised for them to have a safe cooking area. So that is one other project someday when we get people who are interested in engineering and stuff like that and help us with that area. That will be another blessing for those children. Okay, so for vision, so there's a lot of vision in Mr. Steve Jones, Dr. Bay, and other people who are in the school. Thank you, and Mr. Eric, the optometrist from Kilwa. So thank you for giving those glasses, and thank you for volunteering, Ms. Veronica. The people who were at the school, and they are measuring all the glasses. These are the glasses that were donated last year, and we didn't get the chance to distribute them because they came after we left over there. So they were able, and thank you for Dr. Dina Komakoma. She kept them until she came and shared them with us this year, and then they were able to be distributed. So they did see a lot of parents and the grandparents of the children at Minazini who came there. And then you can see there, PC Eric is distributing and reading those glasses and explaining. Yes, Mr. Steve Jones is taking account of all the stuff that they're given there to make sure that they're distributed effectively. So thank you about that. So for this time, at least they were able to distribute 59 glasses. They were able to see 59 people specifically and be able to help them with their glasses. So thank you very much for doing that, but that is a huge task. And this is the area that I know Ms. Veronica has provided a name that we can work with for future project about the vision program. And then so we do need like next time to have like maybe 2 or 3 optometrists from here and then 2 or 3 optometrists from Tanzania work together before we go there. So when we go there, the project is done efficiently, effectively, and then people who are there can get those glasses as needed. And definitely when we are collecting these glasses, it's going to be the reading glasses, majority of it, because it's easier to distribute those. But unless we have actual optometrists with the devices and stuff, then yes, we hold off collecting the prescription glasses. Because if we give them the prescription glasses, donated prescription glasses, it's going to require the device that it has to read the strength and stuff, and they have to calibrate and try to figure out who can get that. So that require more intense. That's why I said we're going to be doing things by a complete team project. So if there's only probably one person and then we don't have other people to help, we're going to probably have to discuss with that person what the impact that one person may have when we go with only one person versus if we go with a team of 3 or 4 people. Because we want to make sure all the projects are impactful in a sense that we go and large amount of the people are helped, and then that'll be a big impact for them versus going do just a little bit here and there, and then we don't have enough resources to help them. And then so this is a very touchy story. I am gonna let Mr. Steve Jones, you wanna share, please?
Yeah, this is the little girl here who came in with her grandmother and her, I think, an aunt or something like that. And she had issues with the sunlight. So when the grandmother brought her in, we didn't know, we didn't even have an optometrist there at the time being, so we had to kind of make do with what we had to do. So we were trying to figure out what was going on. We finally found out that she had a prescription. The grandmother couldn't find it, so the grandmother went and got the eyewear, and but the eyewear was broken. So we just took the initiative and said, hey, listen, how can we help this little girl who's about 5 years old and cannot stand sunlight? Okay. So I just took her down to the hospital, met down with the pharmacist down there. She took me around and we met with the doctor, and we got her. I just paid for the prescription. To get it was like 4,000 shillings, something like that. It wasn't very much. And then 6,000, something like that. It wasn't very much anyway. So pay for the prescription, then come to find out she needed some eyewear, so I wouldn't pay for the eyewear myself, which is like 100,000 shillings. So the whole thing to give her a pair of glasses was like $38, $40. Then I posted on the website, and we had someone came up and gave another $50. And then when I did that, some of the people that was in there, they donated as well. So we ended up giving her 2 pair of eyewear. And so she walked away with 2 pair of eyewear. We gave her a goodie bag with some pencils, pens, and candy and things like that. So it was one of the highlights of my time frame because we found somebody who really needed something. We was able to help. We weren't able to do the thing that we really wanted to do is try to figure out why she was sensitive to sunlight, but we were able to help her by giving her some eyewear.
Now, thank you very much, Mr. Steve Jones. Dr. Siakabe also called, and then of course those arrangements were done, call and notify me at the hospital, and then we will call and notify Dr. Benera. And as I said, I am so grateful with Dr. Benera. As soon as you mentioned, Dr. Benera is the in charge of Mwananyamala, one of the hospital, we do the volunteering. As soon as we notify him, or he would send Miss Atu, the pharmacist, to work with Mr. Steve Jones and find the optometrist right then and there to say this girl needs to be seen like right now without waiting for too long. So it was a very good team effort. And those are the ones like Mr. Steve Jones just said. Those are the highlights that when we do this work at the mission, it just reward everybody because you can see your presence, you can see your impact to this little girl. Now she's able to read or to see, and then she can be able to go outside and go to school. And I mean, as a little girl, you can see beautiful as well. And then so it's something that it touches you. Nobody can do that for you. So it was very blessing. Mr. Sekabe, I see your hand.
Yeah, you kind of mentioned it briefly there, and I know Steve didn't really touch on it, but that one of the driving forces behind our intervention was the fact that the little girl was not going to school, so her eye problems were serving as a barrier to her going to school, because as soon as they walked her from one building or one classroom to the next and she walked out in the sunlight, she couldn't keep her eyes open and she kept blinking. So the issue was just that she could not go to school regularly. And then you could see that she even felt nervous around the other kids because, you know, the other kids can see, they don't have a problem with it and everything like that. So it was more than just getting her a pair of glasses like we were doing for everybody else. This intervention was just really was something that, you know, needed that special attention to help this young girl get stabilized in terms of her education. And as you said earlier, my heart is full.
Thank you. I see there are 2 people raised their hand. Please go ahead.
Dr. Gabone, can I speak to
Yes.
intervention and prevention of the little girl and her eyesight?
Yes.
So on my previous trip to Tanzania, I worked on the unit, the ophthalmology. Well, I visited the ophthalmology for patients, and they developed xeroderma pigmentosa, which is one of the symptoms the little girl is displaying. So I wanted to know, in the effort of following up with her, you know, was she referred or can she be referred to the ophthalmology department so that there will lessen the chance of her going blind? Because that is one of the characteristics of the children that experience pigmentosa, xeroderma pigmentosa, is that they can't process that sunlight, the sun rays. So, and it starts around her age, you know, 4 to 5 years old, and then, you know, things start developing behind that. Maybe tumors or things of that nature starts developing at an early age, and they don't know. And those are some of the characteristic symptoms of, you know, that progression.
So thank you, Vivian, for mentioning that. But yes, so this child was seen at the hospital. The picture here is at the Mwananyamala Hospital. That's one of the hospitals we were working at. And the grandmother or the aunt with her, they were there with Mr. Steve Jones to follow up with the optometrist at the Mwananyamala. That he's the one who was able to gather that information and be able to see that child. Yes. And following up.
Open up, sweetheart.
Hold on a second. On the follow-up, yes, we're going to definitely keep in touch. And we have people at the hospital. As I said, we have Dr. Benella, who is in charge of that hospital, aware of this situation. So we're going to try to keep a close eye with that little girl and the parents or the grandparents, whoever was in charge of it. And then so definitely these are the testimonial that we are looking for. And this is, as I said, if we help one child, this child was being seen, and now she has a bright future in a sense that she'll be able to go to school. She'll be able to do the things that the other girls that at her age can do, and then at least give her the option of be able to say that she can be whatever she wants to do now, but she'll be able to go to school. I mean, that is a huge part.
Exactly.
Yeah, so otherwise she will stay home, as you said, it might end up being blind, and we don't want her to be blind. So definitely we'll follow it up. And I know Mr. Steve Jones have the contact with the parents, and then Dr. Benella and Atu will be involved, and the optometrist at Mwananyamala, definitely.
Exactly. Thank you.
Okay.
Thank you, Victoria. I did not make the connection between the two, but I'm glad that you're here today and you were able to make that connection.
You're welcome.
And then so there's other things that I know we're going to talk about it, kind of like insurance, the things that we can help, especially this little girl. She's going to need ongoing. In Tanzania, majority of the things, unfortunately, they don't have like an annual screening, annual follow-up, or annual physical. They don't have that just because parents cannot afford paying for all those visits because they require money. Some people have to make a decision between the screening and the food. You know what people are going to choose, which we cannot blame them for that. So if this little girl need to have a follow-up, health follow-up, definitely they need insurance. As I said, that is another project that we're going to try to find out that how we can do to try and help this little girl. As Mr. Steve Jones said, he was like 39. I would just say, okay, $40 for this girl to get all that parties done. So how much can we do for her in the future to be able to try and help her? So those are the things those are the questions that we have now. Since we are able to identify and impact that part of this little girl, we have to be able to continue helping her because then we don't want to leave her hanging in the middle of it once we leave. So our impact should be there, even if we're not there. So we have to put those strategies in place to be able to help those people we identify that were in trouble or need help, and then we can continue. So we make those arrangements on the side, and then with every project now, we're gonna go, we have to foresee what else can happen to make sure that we continue supporting that person who have been identified, because you don't want to give her the taste of freedom, and then in 2 years, as what Miss Victoria Jones is saying, then things could get worse if we don't follow it up, definitely. Mr. Sekabe, yes. Did you raise your hand again?
Yes, we have a question from Denise, and she asked, do we take used frames? And I'm going to let Steve Jones, the visionary, answer that question.
Okay.
One of the things that we were doing, we had a lot of used eyewear that was there. And I asked the doctor, which is Dr. Eric, he said, well, we won't be able to use the eyewear because each person, sight may be different. So the right eye might be whatever, and the left eye, and it may not work accordingly. So because they have the prescription the glasses had to be prescription wear. So what I asked him, I said, okay, since you cannot use the lens, what about using the frame? I said, can you take the lens out? Because we have some nice frames and some expensive frames as well. He said, well, they would have to find someone to be able to do that. And right now, they didn't have anybody to do that at the present time frame. So right now, I would say no, but it's something that we can look into the future and maybe see how those frames could be donated to somewhere, to maybe some type of organization who can use them in Tanzania, and they will be able to, donate them to somebody else. I don't know yet, but we were looking into that. And so we haven't found anything, and we haven't discovered anything as of when I left.
Hi, good morning, it's Denise. But so how do they make glasses there overall? I mean, if they must have somebody to put lenses in some kind of a frame.
No,
they
do.
The situation is, it's a little bit different in the United States.
Mm-hmm.
Everything is different. When you go to a foreign country, how they operate and the connection that we have, like we have a whole lot of connection, a whole lot of nonprofit agencies that we can donate to, and they don't need to donate to nonprofit agency until they get down to the end user. Okay, I don't think they have as much well, we at least we don't know about them. Okay, the nonprofit organization that would be able to take the eyewear and be able to do that. That's one of the things that Dr. Eric and I was talking about. If we can't use them, can we donate them to someone else who can? And he would say he would look into that, but as that time frame was talking, he said he didn't have anyone at that time frame. And I am in contact with him every week. We still continue to talk, through WhatsApp. So I'll just ask him, text him a couple questions about the eyewear and stuff like that, and see what have he done. So we left everything with him, and then maybe he can give me some type of answer. Then next time we get online, I'll be able to have an answer for you.
Okay, thank you so much.
So the idea is, I mean, they do have places that they make glasses and they use those lenses, but they for a fee. So we have to work with, because we are going there as a nonprofit, we are going there as an NGO. So we are going there, we have to go to a hospital. For example, we can work with Dr. Benella and see at the hospital and then how they do that. So that is the process that we have to develop on the side to have constant. And that's why I'm saying that this project, we need to make sure they have connection in both sides. We have optometrists here, we have optometrists over there, they work together. So if there's any donation that we cannot use or a prescription we cannot use, then they will make that decision, okay, then take out the lens that has been used, use the frame to do this. And that's what we have to say. We have to have optometrists that have the capability to do that part on the other side. Right now, they are there for a fee. So we had, I think, like 700 glasses. We're not going to be able to afford it to pay for each glasses to be able to change, because they're going to charge us, retail prices. So we have to make some arrangement behind the scene, some strategies behind the scene to work with either one of the hospital that work with the volunteer organization to try and see how we can leverage our resources. If we can't use or we cannot distribute straight to the end user, we give to them and then they work their help and then to distribute to people who cannot afford. Because we don't want people who will get those glasses and go and sell them. No, we don't want that. And that's why we cannot go to the retail people who will be able to do that. We want to go to places that they also work with the nonprofit or NGOs, or they can change the lens and then donate to somebody who cannot afford, because we don't want them to be sold as for profit. We want them to be given to people who cannot afford. And that's why the work we have to be done behind the scene.
Yes. So when we started the vision program, we had Dr. Vanessa with us. So that's why it's important for us to have an optometrist. I know Veronica has mentioned someone. We're going to reach out to that person. And then she mentioned another program that they have at NYU. So in working with Vanessa, it was a lot easier because she already projected more or less how many people we were going to see, because she knew how many people we were going to see more or less. She projected what types of astigmatism or problems they would have with their vision. And so she sent out requests to the different companies, and they donated lots of glasses at all of these different strengths that she had projected. And we went there and she was able to fulfill all of her orders and do everything that she needed to do. So I think if we can get an optometrist on board and we can let them work their magic, then I think we'll be better geared. And when I say optometrist, I mean here in the United States. So if we can get someone on board here, then I think we'll be better able to, or equipped to do what we need to do over there.
Okay, thank you, guys. That's why we do need to have purpose-free projects, purpose-free teams, purpose-free planning to make sure when we start something good to this girl, we are able to continue supporting her by having connection at the local level. So thank you very much. And as I said, we do need your ideas, and we're gonna have that connections next month, especially when we're discussing area for improvement, learning projects and stuff like that. We do need your ideas. Please come back with all those stuff. So definitely, Dr. Kimbi, go ahead.
Yeah, I was going to say that this girl probably needs more than just feeding with a pair of glasses. That goes to my feeling that we need to have a relationship with Billy, the medical school, the teaching hospital, she probably needs to be screened by an ophthalmologist, not just an optometrist. I think her needs, her needs go beyond just having the pair. I mean, she's photophobic. She can't stand light. There's an underlying problem with that. It's not just her vision. That's my perception, that she just can't bear to be in bright sunlight. We can put a band-aid on that, figure out a pair of glasses, have some shades that might make it easier for her to go outside and play with other kids and do the things that kids do. But I think it goes beyond that. That if there's somebody in Mbili, am I saying it right? The medical school, the teaching hospital?
Muhimbili, yeah.
That we probably, if there's a way to connect this little girl with an ophthalmologist, not just an optician or optometrist in a place like Mbili, would probably be helpful.
Yes, and so thank you very much for mentioning that, but we're going to include Dr. Casey. What's her name? Dr. Siakabe? The other optometrist we came and she brought four optometrists with her. The previous one. Yeah, so Casey, so she was an ophthalmologist, and she worked with us before. So I'm going to loop her into here, and she works at Muhimbili. So we can do that. Thank you, Dr. Akimbi.
That's Dr. Redempta you're talking about?
Yes, Dr. Redempta. I remember her second name, Casey. Yeah, Redempta Casey. Yeah, she's an ophthalmologist, yes. Okay. So we can get, she has worked with us 2 times of the medical mission. So we can include her. So as I said, we have to stay with the child to make sure the child gets what they need. So as I said, this was going to happen like 3 weeks ago. So we want to make sure we follow it up. And that's why we need the ideas from everybody else, bring ideas so we can help. And then, so we just don't want to put a bandage, as what Dr. Kimbi said. We don't want to just pacify her and then just leave her out to be, because we did not solve the cause. So definitely we're going to connect her with Dr. Redempta Casey. Yeah. Okay, thank you guys. Okay, this is just a little short.
Here it is, the young lady right here who can barely stand sunlight.
Yes, so those are the
Open up the door. Let me see. Here it is, the young lady right here who can barely stand sunlight.
Okay, and then so this is the one that she was seen by the doctor from Wimbili in the office. And this is the doctor who was able to talk to that little girl. And so now she was given the glasses. You can see the beautiful smile with her waving fingers. And that's one of the pharmacists who was working with Mr. Steve Jones to try and navigate through the registration and the process here at the Mwananyamala. So the little girls have the glasses. So we do have contact with Ms. Atu there, so she will continue helping us, yes. And as I said, Mr. Steve Jones, when he posted it in the group and people were able to donate the money for that little girl to get the glasses and get the treatment, that was a blessing because people jump into the situation like that and help this little girl to have a bright future, that's for sure. But as I said, we're gonna keep in touch with her and the family to make sure she gets what she needs. And this is one of the, Mr. Steve Jones, as he said, there at the end, the little girl now got that. Because remember, the little girl was not going to the same school that we went. So, but she was brought in by her aunt when they heard that there was a vision screening program there.
So this will help her, hopefully she got another bag, to help her in school. Right? I explained what I said to you, okay? Okay. Good, and this is hers.
She said, thank you very much.
You're welcome, man. You're welcome.
Thanks.
Okay.